You're 26 years old, you've got a deep cut across your palm, a fever climbing by the hour, and the nearest hospital is 11,000 years away. No antibiotics, no stitches, no painkillers, just you, a river, and whatever the person next to you learned from watching their mother do it first. And somehow, you survive. Not by luck, not most of the time, anyway. By a body of knowledge so quietly sophisticated that some of it is still sitting in your medicine cabinet today, just with a fancier label on it. So, how did people live long enough to raise children, bury their dead, and pass down entire civilizations without a single hospital on Earth? Stick around, because the answer involves moldy bread, skull surgery, and a plant that's basically ancient aspirin. Let's start with the forest floor, because it was the first pharmacy anyone ever had. Long before written language, healers were already running trial-and-error experiments on plants, one bitter mouthful at a time. Chew the bark of a willow tree, and the pain in your joints fades. Nobody knew why. They just knew it worked, and they passed that knowledge down, generation after generation, until it became ritual. That same bark contains a compound called salicin, the direct ancestor of the aspirin sitting in your bathroom right now. And it wasn't just one plant, in one place. Healers on completely different continents. No contact, no shared language, landed on strikingly similar answers. Garlic, crushed into wounds to fight infection. Certain resins, burned to clear the lungs. Bitter roots, brewed into teas that calm the stomach. When the same solution shows up independently on 3 different continents, that's not superstition. That's applied science, just without the lab coat. Here's the part that really surprised researchers, though. Burial sites tens of thousands of years old have turned up pollen from plants with no food value whatsoever. Plants used only for their medicinal properties. Someone, long before recorded history, was gathering herbs specifically to treat the sick and comfort the dying. That's not blind instinct. That's care, organized into practice. Now, what happened when the herbs weren't enough and the wound itself needed treatment? This is where it gets almost unbelievable. Ancient healers packed open wounds with raw honey. Sounds like the last thing you'd want on broken skin, but honey is naturally acidic, pulls moisture out of bacteria, and even produces a slow trickle of hydrogen peroxide as it breaks down. Modern hospitals use medical-grade honey dressings today for exactly the same reason ancient healers reached for the honeycomb 3,000 years ago. And it gets stranger. Fighters and healers, across completely unconnected cultures, used spider silk to stop bleeding. The silk is rich in a protein that helps blood clot. Some healers deliberately introduced maggots into deep wounds because the maggots eat only the dead tissue and leave the healthy flesh alone. It sounds horrifying. It's also a technique some modern surgeons still use, in a sterilized form, when antibiotics alone aren't cutting it. None of this was guesswork dressed up as magic. It was centuries of quiet observation, refined by people who couldn't afford to be wrong twice. Now let's talk about the procedure that still stuns archaeologists every time it turns up: cutting into a living human skull with nothing but stone tools. It's called trepanation, and it's at least 9,000 years old. A healer would carve, scrape, or drill a hole directly into someone's skull, often to relieve pressure after a head injury, sometimes to treat seizures. And here's the detail that changes everything. Many of these skulls show smooth, healed bone around the opening. Healed bone only forms in a living person, which means the patient didn't just survive the surgery. They survived long enough afterward for the body to rebuild itself. Some skulls even show 2 or 3 separate healed openings, meaning the same person went under the knife, survived, and came back for more. Compare that to a battlefield hospital from the 1800s, where a simple amputation had a real chance of killing the patient through infection alone, because nobody yet understood that washing your hands mattered. In some ways, that Stone Age surgeon, working outdoors with no anesthesia, was getting better outcomes than a surgeon working 3,000 years later in a real building. So why does that sound impossible? Because we've been trained to picture ancient people as helpless. They weren't. They were paying extremely close attention to the one thing that mattered most: what actually kept people alive. Let's talk about the body itself for a second. Because ancient humans weren't just treating illness from the outside. Their bodies were doing quiet work on the inside too. Communities that lived closely together, generation after generation, built up a kind of collective resistance to the sicknesses that already existed in their environment. It's the same principle behind why a population that has lived with a disease for centuries handles it very differently than a population meeting it for the very first time, which is exactly what happened, tragically, when previously isolated peoples encountered diseases they had zero prior exposure to. And there's the food itself. Fermented foods, found across nearly every ancient culture, from soured milk to pickled vegetables to fermented grains, weren't just about preservation. They were quietly seeding the gut with the same beneficial bacteria that modern doctors now pay attention to when they talk about digestion and immunity. Ancient people had no concept of a microbiome. They just knew that the fermented stuff sat better and made you sick less, so they kept making it. Now, let's be fair for a second, because ancient medicine wasn't magic, and it definitely had limits. An infected tooth could still kill you. Childbirth was genuinely dangerous for both mother and child. A ruptured appendix was almost always fatal because no amount of herbs fixes internal bleeding. Life expectancy numbers from these periods look shockingly low on paper, but that number is dragged down hard by childhood mortality. If you made it past your early years, living into your 50s or 60s wasn't rare at all. Ancient medicine wasn't perfect. It was targeted, practical, and shaped entirely by what worked in the real world, tested on real bodies, with real consequences for getting it wrong. And there's one more form of treatment we almost never talk about: the healer themselves, sitting beside you. Across dozens of ancient cultures, healing rituals involved chanting, touch, ceremony, and the simple presence of another person who believed you were going to get better. We now know that belief alone changes measurable things in the body. Stress hormones drop, pain perception shifts. The body's own chemistry responds to comfort and attention. Ancient healers didn't have that vocabulary, but they had the result, and they used it deliberately every single time someone was scared and hurting. So the next time you reach for a painkiller or a tube of antiseptic, remember where the idea actually came from: not a laboratory, a riverbank, a grandmother's memory, a healer who paid attention, tried something, watched what happened, and told the next person exactly what to do differently. You are, quite literally, the result of thousands of years of people refusing to give up on each other. That's not a footnote in the history of medicine. That's the whole story.